It's Monday, November 8th, 2021. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to take a look at an article that comes to us from Brazil and Italy teaming up together. It was introduced into the Veterinary and Animal Science Journal just this year, just recently, in fact. And I'm excited about that because it says that there's people out there who are interested in improving ozone therapy and proving that it works, that it's safe and effective. But there's also much more powerful entities such as the FDA and the EPA and in other countries, their health departments that are really downplaying the importance of and the efficacy and safety of ozone therapy. And that's unfortunate because it keeps many clinics and many people from benefiting from ozone therapy. So they highlight that here and talk a little bit about the legality and the problems that are before us as people who are promoting ozone therapy. And then they jump into lots of different case studies in the science that's been done and do a broad literature search on ozone therapy. We're not going to be able to look at all the information in here, not nearly all of it, but we'll do our best to just highlight a few of the things that are important as we move through. So they take a look at antimicrobial evaluation. They take a look at, let's see, the first one here though, safety. So they prove safety, and they highlight a few different studies that show up to 7 months of being treated with ozone therapy as safe and, of course, as we know, effective as well. And then looking at its antimicrobial power, they say all the treatments lasted 15 days. The treatments based 1 and 5% ozonated citronella, and placebo did not prove to be effective. We're talking about dermatomycosis. And on the other hand, animals treated with ozonated oil were completely healed after 20 days. So that's really cool. Dr. Margo Roman got her name in this particular paper. That's also cool. So we jump into then reproductive medicine, and there's a lot on reproductive medicine. I highlighted lots of different things here. Cows treated with ozone had a similar or improved reproductive performance when compared to the control group. Animals with metritis treated with ozone had a shorter interval of days open until pregnancy and days until the first insemination following calving. And we don't have time to look at all of the things I highlighted. Each of them say something similar to that. So you can go through all those. Then we jump into mastitis treatments, and we look at some of that. So after 24 hours of the last treatment, the clinical analysis in the presence of absence of flakes and clots in the milk revealed no difference between the group treated with gaseous ozone and the ozone one treated with antibiotics. So quick note, gaseous ozone seems to be better than ozonated saline in those cases. And I know I'm talking very fast here because there's so much to get to. Wound healing. They jumped into different things on wound healing. It was possible to observe the antimicrobial effect of ozone in a rapid and good granulation tissue, followed by re-epithelialization of the wounds. So equine joints, laminitis, ophthalmology. So really cool. I've highlighted this before, so I'm not going to jump into it, but really cool results with that. Jump into oncology. Tumor size decreased 20% its original size. After 4 years, this is a different case of the diagnosis and remission. The animal is still submitted 4 cycles per year of intrarectal ozone therapy, presents an excellent quality of life. Sometimes that's all we're looking to do is maintain quality of life. So keep going and jump into infectious diseases. They go through some case studies on that, and then look at the discussion. Let's take a look at the discussion real quick. First of all, they highlight what papers are really not only relevant, but were well done and had the information necessary, and which ones were maybe a little lacking. And then they talk about clinical outcomes and what we can see as the multiplicity of factors impacting ozone therapy and how effective it is. Talk about blood composition of humans versus animals, and all of that type of thing. And then jump into COVID. So lots to consider here. At the end of the day, ozone therapy is safe and effective.